started. First, I want to say good morning and thank you all so much for joining us today. I'm Tracy Cieniewicz, and I have worked in the disability field for 16 years with UCP Huntsville, which is a nonprofit that serves individuals across the lifespan who currently represent 188 diagnoses in addition to cerebral palsy. We also serve their caregivers and the community professionals who work alongside them. I have had the distinct privilege of serving as director of UCP's statewide Alabama Lifespan Respite program since 2018. And before we begin, I want to ask everyone to please go to the chat and type in your name so we can have a record of who is here today. And while you're doing that, I would also like to take this opportunity to introduce you to our newest Alabama Lifespan Respite team member, Jenny Stang. And Jenny, if you're on camera, if you can give us a wave, I want to say hi.
My camera isn't working, but I'm here. So hello, everyone.
And Jenny is our new caregiver outreach specialist, and she'll be conducting caregiver education opportunities just like this one very soon. So we're very excited to have Jenny on board with us. So also just a little bit about us, if you're joining us for the first time. Alabama Lifespan Respite, which was established 23 years ago as a statewide program of UCP Huntsville, is an ACL Federal Lifespan Respite Grant recipient and a member of the ARCH National Respite Network. We serve as the staffing entity to the governor-appointed Alabama Lifespan Respite Coalition, and our program receives state funding as the lead respite agency in Alabama. And I am going to go off video now, and we can look at the presentation instead of me. And Alabama Lifespan Respite serves full-time unpaid family caregivers of individuals with a chronic illness or disability who require full-time care. Our caregiver services and supports include planned and emergency respite reimbursement, the Caregiver Wellness Initiative, which we will discuss today, free online and on-site caregiver education, free online respite provider training, respite awareness, resources, and referrals, technical assistance for startup or expansion of community-based respite services, and state, local, and federal advocacy. And a couple more joining here. There we go. We also partner with the Alabama Department of Senior Services, all 13 Alabama area agencies on aging, the Alabama Department of Mental Health, Children's Rehabilitation Services, and the Alabama Department of Child Abuse and Neglect Prevention to deliver personal choice option respite to their caregivers statewide through our respite reimbursement service. These partnerships also allow us to reach and connect with a very diverse population of caregivers statewide and offer them all of the services listed here. So first, I want to do something a little different today. I want to do a quick poll and see if I can get it going. So our poll says, did you know that May is Mental Health Awareness Month? So if you all right, looks like everybody's answered. Just about, there we go. So it is indeed Mental Health Awareness Month. So we thought this was the perfect time to share information about Alabama Lifespan Respite's Caregiver Wellness Initiative. So today I'm going to share with you how our program has worked to improve overall caregiver wellness, especially for those caregivers identified as being underserved, which we'll talk about in a minute. And we do that through indirect and direct mental health supports. According to research reported by the Family Caregiver Alliance, caregivers show higher levels of depression, suffer from higher levels of stress and frustration, and have lower levels of self-care. Additionally, Female caregivers are at a much higher risk of mental and physical consequences than their male counterparts. And since approximately 90% of the caregivers that are currently enrolled in our respite reimbursement program are female, that's something that's very, important for us. That's a population that's very important for us to serve. Of course, we serve all our caregivers, but since females are at that greater risk for physical and mental consequences than their male counterparts, we especially want to be able to offer supports to them. Research shows that supporting caregivers with information and resources can help them maintain and improve their mental health, which is the core of our mission and why we offer caregiver education opportunity like this one, and share information about our resources. So as we begin our discussion today about the Caregiver Wellness Initiative, I thought it best to start at the beginning and give you a bit of background on how and why it was established. So through one-on-one caregiver supports and surveys of approximately 2,000 caregivers served statewide, Alabama Lifespan Respite identified the lack of emotional and mental health supports for caregivers in underserved populations as a growing problem well prior to the spring of 2020. But this deficiency was just alarmingly amplified in the wake of the pandemic. So in response, Alabama Lifespan Respite quickly developed and implemented a variety of different indirect and direct mental health supports for the caregivers we serve statewide, especially those identified as underserved, including veterans, minorities, the elderly, and residents in very rural and medically underserved areas of Alabama. And the intent of these supports is to decrease caregiver stress, anxiety, fatigue, and burnout, which hopefully results in an increase of overall caregiver wellness, as well as potentially helping to prevent premature out-of-home placement of their care recipient. So how did we further identify this need for mental health supports in 2020? Well, respite staff made welfare phone calls and were able to check in on approximately 800 of the caregivers on our program during the height of the pandemic. So when everyone was at home and, locked in, we made phone calls. Respite staff quickly learned that stress was running very high, nerves were wearing thin, and some caregivers, especially those in very rural areas, might go for days or even weeks without talking to anyone other than their care recipient. So this slide represents words and phrases we heard repeatedly when we asked caregivers, "How are you doing?" Caregivers told us they were tired, overwhelmed, stressed, unhappy, angry. They felt alone, and some felt judged by other family members for just seemingly doing either too much or too little for their care recipient. While most caregivers said they simply needed and wanted someone outside of their home to talk with occasionally, many caregivers also expressed the need for professional mental health support. At the same time, our applications for emergency respite began to significantly increase, and they were citing overwhelming stress, burnout, and mental health crisis as the reason for application. Caregivers were struggling because they thought they had lost, or because they had lost the one thing that gave them, a brief break from the endless demands of caregiving for their loved one all day, every day. They were missing that short respite break, because people couldn't come in, to your home. You couldn't go out like you used to. So they were really missing that break and suffering tremendously as a result. So it became our immediate goal to find new ways to support these caregivers' mental health while working within the restraints of COVID restrictions. One of the great, wonderful, fabulous things about Alabama Lifespan Respite is our ability to respond to caregiver needs in real time. And we began to brainstorm how to offer indirect or soft supports like the ones seen here until we could secure grant funds for direct mental health counseling and supports. We also immediately began offering scheduled care chats for caregivers to talk with one of 3 social workers on our staff for up to 30 minutes each week by phone or by Zoom. We posted care chat videos and topics on social media so we could engage with caregivers of all ages in a variety of ways. We learned during Mental Health Awareness Month in May that being in nature, breathing fresh air, and feeling the sunshine on your skin are simple but important ways to support mental health. So our staff and my daughter created and mailed summer fun caregiver care packages to about 300 caregivers on our program in the most rural and isolated areas of the state. We also created care cards to let underserved caregivers in other parts of the state know that we were thinking about them. And we included a small gift for a sweet treat as well. If you've ever attended one of our monthly break caregiver support groups, you'll know that 2020 was the year that we, like everyone else, went from in-person to online meetings. But another change that happened when we shifted the focus from heavy topics to fun activities was we shifted that. We, went from very guided conversation to let's have fun. So we did things like Christmas cookie decorating and scavenger hunts and bingo and lots of other great things. And we're still doing a lot of these activities because, just to be completely honest, it's a nice break for us too. It's a nice way for us to interact in a different way with you, with our caregivers, and have a little fun. So we hope that y'all are still enjoying those, because we certainly are. While each of these indirect mental health supports helped underserved caregivers to deal with the sudden loss of respite breaks and the intense isolation as a result of the pandemic, many caregivers were still in need of direct mental health support. Our first direct mental health support effort was to drastically increase the amount of caregiver mental health education opportunities that we offered weekly, both live and recorded, to our caregivers statewide. Topics include caregiver depression and anxiety, emotional wellness, how stress affects your mental and physical health, anticipatory grief, and much more. And here's a few examples on the slide. These topics have been presented by both Alabama Lifespan Respite educators and mental health professionals. And through the partnership with those mental health professionals, Alabama Lifespan Respite began building a statewide network of licensed mental health providers who are familiar with caregiver and disability-related mental health issues. This network was utilized in our most direct mental health support for underserved caregivers, the Caregiver Wellness Initiative. So what is the Caregiver Wellness Initiative? To further support the total well-being of unpaid full-time family caregivers statewide, Alabama Lifespan Respite established this Caregiver Wellness Initiative, or CWI as we call it, to provide funds specifically for free mental health counseling to caregivers who are currently enrolled with any Alabama Lifespan Respite reimbursement program. So this means if you are enrolled for reimbursement and you are receiving universal respite funds, DMH funds, or if you are an Alabama Cares caregiver and are enrolled with personal choice option respite with us, then you are eligible to participate in the Caregiver Wellness Initiative. So why is it needed? Again, the intent of the CWI is to stabilize caregiver mental health crisis resulting in the need for emergency respite. So like I said earlier, when we saw that emergency respite requests were increasing because of mental health crisis and extreme burnout, this is how we addressed it. So it was to help decrease caregiver stress, anxiety, fatigue, burnout, which hopefully results in an overall increase in caregiver wellness, as well, again, as to possibly help prevent that premature out-of-home placement of the care recipient. How do caregivers learn about the Caregiver Wellness Initiative? So CWI information has been shared in all different kinds of ways. And when we first introduced this program, we sent out information in the mail, we emailed participants. It's always on our website. We share through social media. We even have been fortunate enough to be able to go on the news and have some articles in newspapers around the state talking about it. We talked about it during these respite education and awareness opportunities and our agency partners. Again, this is for anyone enrolled with our ALR reimbursement program, and new applicants. So Alabama Lifespan Respite reimbursement enrollment applications also include a place for caregivers to indicate if they'd like more information about mental health supports and counseling. If they answer yes, we follow up with each caregiver accordingly. Also, if a caregiver isn't enrolled with our reimbursement program, but they find their way to our website and apply there for CWI, we follow up with each caregiver to see if they need respite, if they qualify for our program. And if they do, then we connect them with this resource. How is this all funded? Those grant seeking efforts I mentioned earlier, they paid off. CWI has been funded by federal, state, and local grant funds since we started it in fiscal year 21. So now that you know why and how we established the Caregiver Wellness Initiative, next I'll share how the program works for caregivers enrolled with any of our respite reimbursement programs and how to apply. So upon receipt of application, eligible caregivers will receive at least one stipend, which is good for 3 counseling sessions to be used with a licensed mental health provider in Alabama. Alabama Lifespan Respite maintains a statewide list of available licensed mental health providers who are familiar with caregiver and disability-related mental health issues as part of this initiative. Caregivers may choose a provider from this list or choose any licensed mental health provider in Alabama, in person or via telehealth, who accepts direct payment for services rendered. And if the caregiver already has a provider in mind that's not on our list, we will make that contact with that provider and ask them if they accept direct payment for services rendered. So far, we have not had a provider who said no to that. But just wanted you to know that burden is not on the caregiver. We will reach out and make that request. A question we often hear is, how did you decide to start with just 3 counseling sessions? So as you know, we are not mental health professionals ourselves. So this decision was made upon the collective recommendation of the mental health professionals we partner with for CWI. It was generally agreed upon that 3 sessions can stabilize a mental health crisis in most situations. So caregivers begin with 3 sessions, and if mutually agreed upon by both the caregiver and the mental health professional that more sessions are needed to stabilize a mental health crisis, then we will award another stipend for an additional 3 sessions. Alabama Lifespan Respite pays the mental health provider directly, like I said before, up to the awarded stipend amount for services rendered to the caregiver. So again, we pay for those 3 sessions. And so you never see a bill that comes directly to us. Caregivers will be asked to complete anonymous pre and post counseling surveys to help us determine the effectiveness of the program and to show our funders the effectiveness of the program, which hopefully enables us to continue receiving funding for this needed service. Caregivers who express a need may also be eligible to receive technology to access teletherapy. So if you're in a rural area and let's say, there's not a provider in your area that you on our list or of that you would like to see in person and you'd rather go teletherapy option, but you don't have, a tablet, then we can provide that tablet for you to access telehealth to receive your therapy sessions. And that tablet is then yours to keep, and you can use it to participate in online education like this and other caregiver education opportunities online. So how do you apply? You go to our website, alabamarespite.org, and under Access Resources, you'll see information about the Caregiver Wellness Initiative. This application is very short. It doesn't require any additional paperwork, and it has no income requirements. We just want to make this process as easy as possible for our caregivers who are seeking mental health support. So this is where you go on the website. Like I said, you go up here, alabamarespite.org, go to Access Caregiver Resources, scroll down and click on the Caregiver Wellness Initiative right here. And then you'll just fill out, again, that brief application for assistance You will also see information there about our emergency respite funds. So if you attended the Training Matters presentation with me a couple weeks ago, I mentioned how free respite provider training and background check stipends are funded by the same source. So CWI and our emergency respite funds also share a funding source. So that's why you'll find that information together on our website. So again, we're trying to decrease the need for emergency respite by offering mental health support. So all that information can be found there together on our website. So is the Caregiver Wellness Initiative positively impacting caregivers the way we hoped it would? I personally would say yes, because since September of 2021, requests for emergency respite due to overwhelming stress, burnout, and mental health crisis have decreased by more than 90%. So we feel like that is a tremendous impact in a short amount of time. One of the very first caregivers to participate in the CWI program emailed us and said, I felt immediate relief from day one of counseling. And this was absolutely the best feedback we could have possibly received, because we knew then that we were now able to provide a direct mental health support to caregivers statewide, especially those who are underserved. So what is the takeaway? As I mentioned earlier, lack of emotional and mental health supports for underserved family caregivers was a growing problem well prior to the pandemic, but it was amplified during the pandemic, and we knew we had to do something. As a result, Alabama Lifespan Respite was able to identify opportunities to respond to emerging caregiver needs, reimagine the way we delivered respite, and create new indirect and direct caregiver mental health supports that will be impactful, well beyond the pandemic. So this is something we hope to continue for a long time, because we know it's a needed resource. So what questions do you have? I know we've covered a lot of information today, and I am always glad to answer any specific questions you may have about the Caregiver Wellness Initiative or about Alabama Lifespan Respite. So if you like, you can come off chat or come off mute, or you can put your questions in chat, and I'll be glad to answer any questions you have. Y'all are awfully quiet today.
Well, I don't have any question, but I am grateful for your program, because it truly has been a blessing, to me.
Well, thank you, Mr. Gibbs. We truly appreciate, each and every one of y'all, but thank you for saying that.
Mm-hmm.
Does anybody have any questions about CWI?
Good morning, I'm Shirley Wilson, and I'm in the Birmingham area, and I had signed up, but it's hard to find counselors that's available right now.
Yes, it is. It really is. And usually what happens is with the providers, if it's going to be more than 3 weeks, they usually are good to let us know that, and they'll, and tell us to have the caregiver choose another provider. I'll come off video. And if you need us to do that, please let me know. If they haven't contacted you and let you know, let me know, and I'll be glad to make those contacts for you.
Okay. I have received a list, but I had called a couple in Birmingham, and they had not gotten back with me.
Yeah, and we'll be glad to make those calls and send a referral. But just let us know. We'll be glad to do that for you.
Okay. Thank you. I mean, your resources have been amazing to me, and I really, really appreciate it.
Well, thank you. We appreciate y'all.
Well, Tracy, hi, this is Sonia, and I have used the services, and I also had trouble finding, I'm in the Birmingham area as well, and I also had trouble finding a counselor. So what I did was I went outside my area, because most of them, do it by Zoom anyway.
Yeah.
And I went outside my area, and went, to Huntsville, just, an office. And they responded, and that's what I've been using, and it's been a great benefit.
Wonderful. Yeah,
So
that is
that might be an option.
yes, thank you for sharing that. It's that is one of the, we have to find the silver lining in things. And that has been one silver lining, is that I think telehealth and teletherapy is so much more readily available now since the pandemic. So that is, one good thing to come out of it. If you have to find good things, right, that come out of the pandemic, I think that is one that we have better access to telehealth now. So thank you for sharing that. Yeah. Well, if y'all don't have any more questions, I do hope this information has been helpful. And I thank you as always for spending time with me today. If you haven't already, please don't forget to go to the chat and type in your name so we can have a record of who is here today. And if you enjoyed this caregiver education opportunity and are interested in attending others like it, please visit alabamarespite.org and click on attend events and to see what upcoming classes that we're hosting, as well as those hosted by our agency partners statewide. You can also visit us on Facebook and browse events or sign up for our monthly newsletter to have all caregiver education information delivered right to your email. And speaking of email, please don't forget to complete the post-test link. I'll email you today to see if you qualify for a respite stipend. And your willingness to complete these pre and post tests gives us important data to share with our grantors to prove the effectiveness of caregiver education, so we can continue to offer trainings like this each month. So we thank you so much in advance for helping us with that. So thank you again for joining us today. And as always, thank you so much for being an awesome caregiver. Thank you for all you do. Please reach out to us if you have any questions, and please share our resources with other caregivers who may benefit from our services. And that's all I have for today. Thank y'all so much.
Thank
Have a
you.
great day.